Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. Today I want to share with you correlation that I've seen between trans women prior to starting gender transition. So basically anybody who knows the struggle with gender dysphoria, knows that their identity is trans feminine, and they have not yet taken the steps or maybe don't feel like they need to take steps. Um, well, let me rephrase it. It's not that they don't feel like they need to take steps, are not ready to take steps, but want to take steps forward. So the correlation between trans women prior to starting gender transition and anger issues. That's right. I said anger issues because there is quite a misconception there why trans women, it's not correlation across the board. It's not for everybody, but I've seen a lot of people by now that struggle with anger issues, and once they do start gender transition, guess what? Anger issues miraculously go away. Why is that? And there is a very big misconception. One of the reasons why I'm making this video is that the reason why anger issues, anger outbursts, explosive anger type of behavior tends to go away is because you are now on hormone therapy. And that means no more testosterone. That means now introduction of estrogen. And that is, in my opinion, not true. Testosterone does not cause, there's no causality that testosterone leads to people being angry. Yes, testosterone is a reactive hormone. So, in other words, it is a hormone that's that much more susceptible to reactiveness, right? But there's difference between reactiveness and anger. In my opinion, if a person has a reason to be angry, testosterone or not, they're going to be angry. Not to mention, we know so many individuals in the world who have testosterone raging through their bodies and they are calm as a cucumber no matter what scenario you put them in. We also know a lot of individuals who have estrogen raging through their veins who have anger issues. So I just don't see hormone being responsible. I think it's such a um, yucky stereotype toward testosterone that testosterone makes you angry. I've seen a lot of also trans masculine and trans guys concerned about going on testosterone because they were afraid it's going to make them angry. Again, if you have reason to have anger issues, if there is something there that is triggering you, you're going to have anger issues. Okay. Anger outburst, anger, having anger oriented behavior is a behavioral, there I just said an anger oriented behavior is a behavior. It's the way we behave. And the way we behave can always be modified. We can always um, rehabituate, relearn, and readopt a way to behave in a much more mindful, calmer way. So it's no way is it tied to testosterone. Why is it then that, in my experience at least, I have seen, I wouldn't say all of my trans women clients, because my work, majority of my work, I would say 90% of work that I do tends to be with trans women. And so I would say probably about, I would say it would be 50-50 split, to be honest. I would say about 50% of people I worked with have struggled with anger issues prior to starting gender transition. And a lot of times people are really surprised that once they started gender transition, anger issues went away. And on top of that, their partners or family members or friends, anybody else in their immediate environment has not only noticed it, but we're surprised by a drastic change from somebody who was just irritable and angry and had outbursts of things to now being calm and mindful and receptive and being more comfortable doing things you were really pissed off doing before. Why is that? Again, it's not hormone. It's not because you are suddenly on estrogen. Estrogen is not a pacifying hormone, trust me. I know a lot of women who are not very pacifying. I mean, I'm not even going to go there. I was going to say something in politics, but we're not going to go there. So, look, here's the thing. When you are struggling with gender dysphoria, you are undeniably struggling with innate incongruency with the core fundamental part of who you are, in this case, gender. When we have unresolved tension between parts of ourselves that are so fundamental to who we are bound to start feeling annoyed first and foremost, and then we're bound to start cultivating a sense of tension about that annoyance. And what you're feeling annoyed about is your life, is that your life is not according to how you want it to be. In this case, your gender is not in accordance with what you feel authentic to be. And the more time goes by and the more gender is not being addressed, the more tension you are building within yourself. The more tension you're building within yourself, guess what happens? Anger starts to arise. It's not that you suddenly become angry. It's that the tension becomes so much, it starts to decrease your capacity to tolerate external environment. When you can't tolerate external environment anymore, for example, coming home and finding out that your dog peed on a couch and now you have to clean it up. If your life is, let me rephrase it, not that your life is in order, but if you don't have a deeper internal conflict with yourself, you have more tolerance to those kind of daily things happening in your life, right? We'll know this, we'll experience it. When your life is not in alignment with your core self, you have internal deep conflict, you're going to be so annoyed that the dog peed on the couch, right? So the next thing you're going to do is that because the tolerance has been decreased, you have lesser capacity to tolerate it, you're going to have what we call angry outbursts, right? That's how anger arises. So anger actually arises as a behavior, as a response to not having capacity to tolerate whatever situation we presented with that we have to deal with immediately. And the reason why your tolerance has decreased is because day to day, year after year, you're experiencing internal sense of inner conflict with yourself. Anybody in the world that has a deep inner conflict with anything that is very essential to them, inner conflict, I'm being married to somebody who I hate, I have resentment, I have contempt, I want to divorce them, but I can't leave them right now, is going to breed low tolerance. It's going to lead to behavioral issues that may most likely come across and manifest as anger outbursts. I hate my job. Every day I wake up, I have to go to work. I hate it. I have to see my boss. When you wake up thinking about those thoughts and you start cultivating that narrative, and then you go to work and 9 to 5, you have to sit at the desk and you hate everything about it. Guess what? That hatred is going to fuel something in you. So don't expect to come home and then seeing your dog peeing on a couch and not have an angry outburst. Do you see what I'm trying to paint here? Same thing with gender issue. You wake up every day, a lot of you to a lesser to a greater degree, thinking another day that I have to navigate my life in this body, another day that the world is going to gender me based on my assigned gender, based on this presentation that I'm not comfortable with. Another day I'm going to be served. Another day that I'm going to have to be at my work on a lunch break, trying to pretend to have these manly conversations I have no interest in. Another day I have to wear, I don't know, cargo pants and maybe a shirt and a tie. Another day that I have to pretend to be a man in my relationship. All of the things a lot of you do in order to avoid dealing with gender dysphoria, in order to avoid dealing with who you fundamentally are, is going to breed tension. That tension is going to decrease your tolerance for, again, your external environment. That's how people end up being angry. That's how people end up carrying anger issues. I often see people, you know how I said it's 50-50 split in people that I work with? I would say about 50 trans women I work with have anger issues prior to transition, 50% do not. The ones who do not, the reason why I don't see it, it's not that they have capacity to tolerate things more. It's that they're much more in denial or resistant to even being in any shape or form aware that there's gender dysphoria. They have come up with some kind of justifiable narrative for themselves in order not to confront it. Whereas this group over here is very, very rare, maybe even has severe to moderate gender dysphoria where you are viscerally aware of it. And so every day, because you feel it, you inundate it with it, is going to breed low tolerance. That's going to lead to short diffuse. Short diffuse leads to anger outbursts. That's how it works. This is why, if you're not out and you are in a relationship and you have those angry outbursts when you come home from work or in the morning with your coffee around your kids and around your spouse for things that are so disproportionate to them. Let's say your partner says, "Hey, can you stop by FedEx and drop off this package?" And you just have an angry response to your spouse. Your spouse is going to be all confused. What's the big deal? Why can't you just drop it off? You come home and um, you find that somebody has misplaced remote control to your TV and you're going to have an angry outburst and your kids are sitting there wondering, what is the big deal? It just misplaced. Let's just find it. There's going to be a disproportion, right, to the anger outburst. And it's going to lead to people around you feel very confused because guess what? They have no idea you're struggling with gender issues because you are living in secrecy. You're not out. You're not sharing that with anybody. So they have no idea. And especially if a lot of other elements in your life are in order. For example, you love what you do for a living. You're happily married or whatever, you're in a happy relationship, you love where you live. All the more it's going to lead even to more confusion because people are not going to understand what the heck is making you tick. And so as a result, you're going to come across as like this eruptive volcano grenade that goes off at any time. You're going to come across as really an abusive personality. People are going to start working on eggshells around you. When people start addressing their gender issues and they start also doing something about it, it's not that, oh, there's no more, my testosterone is going low and I'm now on estrogen and therefore this is why I'm warm and fuzzy and I'm no longer an angry person. No. Anger, again, is not related to hormones. Hormones are not responsible for people having angry behavior. What happened in this case is that whatever it is you were not able, in this case, the dysphoria that you were not able to tolerate, you suddenly started dealing with it. Because you started dealing with it, guess what? The tolerance that was very decreased starting to increase. So now you're able to tolerate things because you have space to tolerate them without getting angry, without having a grenade go off. This is why now when you come home and you find your dog that has pissed on a couch, you're not blowing off the charts. And again, this is not because you have estrogen in your veins. It's because you're now addressing a core issue and you're now living your truth. This is why when you come home, are you going to be equally frustrated that the dog pissed on the couch? Yes. Are you going to be happy? No. But guess what? You're not going to be as pissed off as you were before. This is why when a person starts addressing their gender issues, people around you are going to start wondering, wow, what the heck? You are such a different person. You are so much nicer to be around. You're so much more pleasant to be around. I don't feel like I'm walking on eggshells. For those of you who are taking hormones and have not yet come out to people around you, have not yet come out, especially if you are in relationship, marriage, or long-term relationship, and your partner spouse is wondering, why the heck have you changed in behavior? It's a hella confusing time for them. This is where you have to be very careful because your spouse is going to start making their own reasons and explanation narratives and assumptions why you're so warm and fuzzy. I had a spouse tell me that Dr. Z, I think that my partner is having an affair because was such a raging anger behavior, and now suddenly totally nice person, and nothing has changed. I think they're having an affair, or I think something else is going on. What's going on is that you're addressing your core issue, gender dysphoria, and you haven't told your spouse yet. That's what's going on. So, um, be mindful, it can backfire too. But this is one of the main reasons why trans women prior to starting gender transition a lot tend to experience anger outbursts. This is why there's correlation, and this is why it tends to go away or diminish completely when a person starts living their authentic truth. Because again, when we start living our authentic truth, our tolerance goes up. When our tolerance goes up, we're nicer people. Anybody knows this. When things in your life are more or less all right, all of us are better people. Comment below, let me know if you experience this. This is so common. I hear this so many times. I have a lot of clients who feel this way right now. They keep telling me, Dr. Z, you cannot believe it. Things that I'm able to do now, where before I'd be so pissed off about doing those things. And these are some basic things, Dr. Z, but now I can totally do it. And I don't even know why it was such a big deal before. Well, yeah, because you're no longer carrying this tension. You're no longer carrying this internal fight, this internal battle. So you have space and you have reservoir to confront other things in your life. That's why I always say people become more productive in their life, work and otherwise, when they are addressing their gender issues, because that space is cleared up. You can focus better on other things because you're taking care of this fundamental core thing. So comment below, let me know if you experience this, if you're experiencing this right now. I'd love to hear all of your comments, and I will see you all next time. Goodbye.